This week on the BackTable podcast.
We have 3 items that really help us identify quality matches. And so this is helping the candidate find the job and the employer find the best candidate for that job. And so what we do is we do something called a stat score. And so the stat score looks at certain criteria. The location, is we give our users 5 options to put in a location, and we're help search. And if it falls within those 5 locations, they're going to rank higher on that score. Do they want call? Do they want weekends? A lot of certain specifics that's maybe overlooked in other sort of means. And so our stat score really helps us identify, is the fit there? Is the culture there that we're looking for both sides?
Hello, everyone, and welcome to the BackTable podcast. Today, we have a very special episode on helping docs and healthcare workers find the right job. We've covered this topic in a couple different ways, including on prior episodes 110 and episode 201, where we talked about when the first job is not the right fit. We also talked about good jobs versus bad jobs. But today, I'm honored to have physician entrepreneurs, Dr. Rockford Adkins and Dr. Kasie Adkins on the show to tell us about their startup, which is statcareers.com. So welcome, guys. Thanks for coming on the show.
Yes. Hello, everyone. Thanks for having us here, Aaron.
Yeah, we're super excited to be here. Thank you.
Yeah. So let's start with some intros. So Rockford, Rock, is it all right if I call you Rock?
Yeah, I go by Rock most of the time.
Cool. Rock is a fellow interventional radiologist, and Kasie is a Mohs surgeon, correct, Kasie? Am I right?
Correct.
And you guys, did you meet in med? Just tell us how you guys met and like your kind of, med careers thus far.
Sure. So we met in a steamy hospital romance as interns.
Yes.
And ever since, that has been our journey. And so I'll start with a little about myself here. So I'm a diagnostic interventional radiologist in the Midwest, and I did most of my training throughout Ohio. Popped out to Baltimore and did my interventional radiology fellowship at Hopkins, and ended up here in Cincinnati and been here for 6 years now in private practice.
Yeah. And so I completed my dermatology residency throughout Ohio in 2015. And then I worked in private practice, an employed hospital system, and an HMO. And then in 2020, I quit my job and I went back and completed a Mohs fellowship at the Cleveland Clinic. And I have been in private practice for the last year as a Mohs surgeon.
Cool. And Kasie, so you were just doing general dermatology?
I was,
up until
yeah. Yeah.
Okay. How was that going back? Because you practiced for what, 3 or 4 years before you went back?
Yeah, I was in practice for 4 years.
How was it going back and doing, training? I mean, it's what, is it a year, the fellowship?
It was 1 year, but I'll be honest, it was the hardest thing I've ever done in my life. Rock stayed behind in Cincinnati, and I took the 3 kids to Cleveland, and I did not have children when I was in med school. I had our first child at the end of my 3rd year of dermatology, so that, the last year. And I give people so much respect now, like who had kids in med school and in residency. Rock and I say that all the time. Like, how did they do it? So I was also a little bit older. So, more fatigue, I think. And then having 3 kids and not having a spouse there, it was definitely the hardest thing I've done.
Yeah, that sounds like a huge feat. And we're going to talk a little bit about, job satisfaction in a minute. But what was it that you... were you always planning on eventually doing a fellowship, or were you just like not happy with the way your general derm practice was going? It was like, you know what, I really want to, do something different. Like, can you tell us a little bit about that?
Yeah, a little bit of both. I think, I did want to do a Mohs fellowship, and I lost my father in residency, and I could just kind of like change my perspective on stuff and wanted to get my life going. And we had just got married, and I said, let's start a family. We're running out of time. And then Rock was applying for IR, and it didn't make sense for us to do these 2 competitive specialties for fellowship with a baby and potentially be apart. So, I went with him to Baltimore, had the baby, and then came to Cincinnati, and we just started working, and I was not happy. And it was a really, really hard decision, but I was really unhappy in my career, and I couldn't believe that I came this far and had gone through all of this, and it was not satisfying at all.
Yeah, that's, Gopi and I had a kind of a similar thing because, I was just with staggering fellowship, right? Interventional radiology and ENT, very similar. And so we decided to stagger our fellowships because we knew from even matching, from med students into residency, it was so hard to get into the program that you really want to get into, right? So we wanted to kind of be fair to each other and say, all right, you do your fellowship first, and then and that's what Gopi did. She just worked for a year doing locums while I did my fellowship, and then she got into the program she wanted. And that's kind of how we ended up in Dallas. But just speaking from experience, I know how tough that is, and those decisions, and then throw kids into the picture, and it gets really stressful.
It was certainly stressful. And I didn't understand or appreciate that once you start having your family, if you want your children to be close in age, the time just passes really quick. And so, in the middle of his fellowship, we decided to have our second kid because I wanted 3 or 4 and I didn't want them to be too far apart. And so you always think, or at least I did, at what point in life should I have my kid? But really, you also have to start, once you start your family, if you want them close or you want a lot, and you kind of have to just keep going. So that's just more stress and less time for your career.
Right.
And then, so for the record, we have 3 kids. We had them in 4 years.
Yeah. So we have a 7, 5, and a 3-year-old now currently.
Yeah. That's busy. That's super busy.
Busy times.
Yes.
Yeah. So let's talk about, you guys have busy careers, busy family, but yet you have this passion for, you had this idea to start to do a startup, Stack Careers. Tell us how that came about.
Yeah. So I'll go all the way back and rewind to being in residency. And I think I was really intrigued in residency when we did a career day. And so we brought the residents that had graduated the years prior back, and we talked to them and said, essentially, what are you doing? Can you be transparent with this? What's your salary? What does your job look like? And it was just really intriguing to see the variability there. And so I remember we had one individual come in and say they were making $150K in an academic practice, working 2 or 3 days a week in California. And the next guy would walk in and say, hey, I'm going to make 7 figures and I'm in a high volume private practice in the middle of, the Dakotas. And it's like, wow, we've all had a similar path, yet then we diverge at a certain point. And so I can say early on, I was really intrigued by how these jobs come about and the variability involved. And so I think the real first inception of Stack Careers was probably when you had your first job.
Yeah. And so, that's his kind of pain point, which I share. But another huge pain point for me was just the fact that we finished residency. He was going to Baltimore and I needed to find a job, and I could not find a job, right? I just started Googling, started looking at the American Academy of Dermatology, friends, family, mentors, cold calling offices. And I was really kind of frustrated and almost sad that, I had spent all this time and money in my life and thought I was going to have this great glamorous job, and I couldn't even find one. And we talk about this a lot and we joke, and I'll say, you can go on an app and you can find the partner that you're looking for that night within a 10-mile radius, who's a certain height, a certain weight, certain eye color, has certain hobbies. But yet I can't find a job, right? After I just spent, my entire 20s training, and I'm highly skilled. So that was kind of a really big pain point. And then, like Rock's alluding to, when I did find my job, a certain percentage of my first year salary was taken away to the recruiter that I used. And it left me very limited negotiating power. And because I didn't lie and say we were there long term, I was very upfront. I thought that was the right thing to do. Like, hey, I'm only here for a year with my husband during this fellowship. Well, then, they can't make the money back off of you. And I had very little wiggle room because part of that salary was going to the recruiter, which, I had no idea that I was basically paying the recruiter out of my first year salary.
Yeah, it's really eye-opening. And so that launched us into looking into the industry to see. And so just for full transparency, that individual was asking $30,000 to place her into a job. And so that was for a simple introduction, online. And it really blew our minds to say, wow, is this how things are? Is this really how it happens? And the more research we do, that's the norm. You pay 20 to 30 grand if you use a third-party recruiter or an agency for that. most of the time to find a job, and it comes out of somewhere, right? It's not like that money is just magically appears. So it either comes out of your signing bonus sometimes, or your salary, or it stresses the health system. And so I also had an experience when I was first looking for a job. It was an OBL type setup. And I remember talking to the individual and said, hey, what's going on? Is there a signing bonus? Can you tell me some stipulations here? And he looked right at the practice manager and said, did he come with a recruiter? No. Okay. Yes, we'll give you a signing bonus. And so that was our first sort of like key that, hey, something isn't right here. And they might be getting way overpaid for that. And on top of that, a lot of them come to find, and this is nothing against third-party recruiters, but they present the candidate with the least amount of risk, right? Because they have an underlying bias to have you signed. And so they may have a great candidate, but that candidate may not want to work in that area, so they're less likely to sign. Yet they're going to present the people that are of lowest risk, and they want you to sign so they get that money in that contract closed.
Huh. That's wild. I always thought that these recruiters were getting paid by the groups or the hospitals that you get the job at. I thought that was what drove, that was their business model, but I didn't realize docs were having to pay.
No, so they are paying you, but it's coming out of your salary.
Indirectly. Yeah. So it's not like we're paying.
I mean, that money has to come, that money's coming from somewhere.
Yeah. Okay. I see. So they're just, but it's not, is it ongoing throughout the year, or is it a one-time fee that they get paid like when you sign on?
I believe it's a one-time
it's typically
fee.
Like a certain amount up front to begin a search, and then a certain amount to close the deal. And it is paid by the institutions, just to clarify that, but it indirectly can harm you, unfortunately. And if you're not aware of that.
Because they're just going to pay you a lesser salary, basically. Like
or not have a signing bonus, or.
Yeah, it's coming from somewhere, right? And it's usually going to be out of somewhere that you're going to make money somehow. So.
Yeah.
And so to go back to the search, on my part, I'm a bit OCD, I will admit that. And so I remember I had so many different accounts signed up on different fragmented websites, and I was running job alerts and emails, and I really wanted to know, we put in all this time and energy into becoming a physician, 13, 14 years training. I want to know what the best job is out there. And so I had to do quite a bit of legwork on my part to find out, what is the best job. And it became like a second job on my part. I remember, submitting my CV to random job sites and never having a response and not knowing where that sensitive information went. And I remember multiple times I traveled to a job, and this is becoming less so, but in the past it was very taboo to ask, certain stipulations that really were important to your job. Like, how much will I be paid? Like, what's the setup, the structure? Am I going to be, a partner, or is this going to be, RVU based, or how will this be set up? And so you had to essentially throw your suit on, fly out, spend your time away from your family, and do a lot of legwork to find out that maybe this job doesn't even align with close to what you're thinking. And so we just thought there was a much better way to do this, especially with the advances that we have in technology.
Yeah. So when you guys came up with this idea, like, hey, we need to, these are our pain points. We feel like our colleagues are experiencing these pain points. Like, where did you go from there? Like, you're like, okay, there's a business here. What was your next step?
The next step was to go to the other clientele, as the hiring managers. And so the good thing about training and being a medicine is you're in a lot of facilities. And so you have access to a lot of the hiring managers and seat levels even. And so we started talking with them and essentially laying out our issues. And they had many issues on their side as well. And we realized that, hey, kind of the light bulb went off and said, this is a problem that we can solve on both sides with one platform. And so with them, they had a lot of vacancies, a lot of turnover, retention was very low. And despite that, they were spending tons of money. We have like a case example of one of the clinics that one of us worked for had spent $200,000 that they blew through on recruitment for just a small department in a small community hospital in a year. And on top of that, they were issuing salary cuts to everyone from that. And so I think the take home point is that when there's waste in medicine, in the process and business of that, it falls on everyone, right? It harms us and the organizations as well too. So we saw this as a all-inclusive problem that we wanted to fix on both sides.
And that was another pain point, right? So the system was, about $200,000 down. And so something that in a million years I never thought of, I've never seen on any blog. And I certainly, my contract attorney did not mention it. But knowing your conversion factor for your RVU is important. But what's more important is knowing that your organization cannot change that conversion factor more than X% per year. Because there's nothing in there that says that they can't drop it, 8 points, which is a significant amount of money, right? So, where I worked, we were told we had 3 months and they were going to drop it about 20%.
Yeah. They just basically said that, sorry, we mismanaged the department. Here's your new rate.
And that staff turnover was so high, like ancillary staff, as a reflection of us as the providers. Being difficult and not being team members. And so, it was kind of on us that they had to spend all this recruitment money and didn't have retention.
So when you guys were doing your market research around this, you were looking at not just physicians finding a better job, but nurses, techs, basically everybody within the department.
Yes.
Yeah.
Everyone, yeah.
And because as you know, it's very much a team sport, right? And so many times, like, it may be more important to find this one nurse that's willing to do something, than maybe even a physician in the facility.
Right.
And so we saw this as sort of a broad approach. And so not only did we talk to the hiring managers and C-levels, we talked with all the people we work with, right? In the interventional radiology suite, we're in there with respiratory techs, so like anesthesia, CRNAs, and nurses and techs on top of that. And so we're very transparent and open. Like, tell us what issues you have with getting a job. Like, maybe we're doing a case and or after the case or whatnot. And everyone was very frustrated is what we found.
Yeah. Yeah. We recently did an episode on staffing the OBL with this vascular surgeon out of Columbus, Krishna Manava, and his office manager. And I asked them, I said, what is the hardest role to hire for? And surprisingly, they said the MA. Said it's really hard to find good MAs that stick around,
It really
is. Just had such significant turnover. And the other interesting thing, I was looking at Yale's website last night, and even transporters are on your list, right? Oh. Like hospital, talk about throwing a wrench in the gears of a hospital service line, right? If you don't have transporters, I mean, you're dead in the water, right? You're sitting around waiting for patients to come. The nurses are upset that they have to go and get them. So you're right. I mean, it just shows how every role is essential in the workflow of a efficient hospital or OBL or even clinical practice. So I love that you guys are covering it from head to toe. It's not just all about docs.
Yeah. Well, thank you. Yeah. I mean, the team is so important to physician retention. And, if people are miserable, the whole team's miserable. It's just a downward spiral, especially in the outpatient setting where I worked.
Yeah.
We had 3 doctors in one little hub. And so if one doctor was upset and their staff was upset, kind of all the hub felt it, right? And then it just like negativity kind of breeds negativity.
Changes the culture of the whole place. Yeah. Yeah. A friend of mine, they moved to San Diego, and she's a primary care doc. And she said that they just can't, they have such a hard time with MAs that it's just disrupts the whole workflow of the whole place. And it gets to people that it spurs resentment, right, amongst the staff, because if you can't have quality people that perform the basic functions of the clinic, all that negativity just spreads, right? And like you said, it upsets the physicians.
And the responsibility. I mean, at one point I was the MA and the physician, right? I roomed the patients. I would go to the waiting room and get them myself. I would bring them back, give them a gown. So, just so we weren't running 3 hours behind, so that we were only running an hour and a half behind, which was still unacceptable to the kind of practice I wanted.
Which is why she was so unhappy.
Right. Yeah.
Yeah.
It makes a huge difference. And so let's talk a little bit about, okay, so you did your market research. You realized, there's a lot of reasons, that are leading to job dissatisfaction and recruitment. What was the solution that you proposed? Did you present this to, anybody to kind of get more feedback? Or did anybody shoot you down? Any challenges in terms of like going from the idea to starting implementation, starting the business?
Sure. So our market research pointed to, I think, one thing that stood out. There's a lot of different issues you could bring up, but the main thing was an unintentional lack of transparency. And there's literature that shows this, and I think it's very true. And so we wanted to bridge that gap in transparency. And so I started formulating a system that would sort of apply to everyone and help fix this problem. And so what I did is, on my side, like my background, a very blue collar background, I grew up as a mechanic and worked in a car dealership. And so I learned business from working in a family car dealership, but by no means was I a prior like tech startup entrepreneur. And so I had to go back to pretty much step one. And so I reached out and I got on LinkedIn. I would find leaders in the startup field in the region, and I would take meetings with them. And I think that was one of the hard things to do for us. And going back, just kind of talking personally, is as physicians, we're very accomplished and kind of like moving up the hierarchy. And I had to completely reset myself and remove any ego which might be there and just start, listening to whatever I could to take advice on how to build this, get the lingo of the system, and really go back and do research, how to draw up a business plan, things like that. And I did that. And there were many times where people would set up meetings and they would last minute cancel on me or ghost me or, that. But there are also very many people that I met with that would help me and would steer me in the right direction. So we had direction from the startup community here in the Midwest and Cincinnati area. And so that was nice, but we really had to go back to square one.
Yeah. That's so true, man, with this whole startup mentality. Like you really got to set your ego aside and you are starting at zero because we're top of the food chain in the hospital. We like to think we are, right? Walking around. But, you sit down with a business person and they don't care. They don't, they'll be respectful and call you doctor, but that's about the extent of it because they have so much more experience, and that becomes clear if you don't have any experience pretty quick. And so I had to learn a lot of that too. It's just being a little bit more humble, I guess, and be respectful of one another's time too. If you're going to show up for a meeting, you have to have an agenda. You can't just fumble through a conversation because they're going to be like, why are you wasting my time?
Absolutely.
Yeah,
and it's like an elevator pitch too, right? You only have 2 minutes of attention with someone who's very busy that can lend you some insight. And so you get better. It's almost like, and like a good analogy for what I think is, the more I interviewed throughout medical school, residency, fellowship, the better I got at interviews. Right. And the more meetings I took, the better I got at talking back and forth and answering questions. And they would trip me up and how would you build this or that? And, I go back and I think, and I, come back with an answer for the next individual or to that individual and follow them up. And so, it was definitely a learning process. And it sounds like you can attest to some of that yourself with what you've done here. This is very special though. I like what you've done here, Aaron.
Oh, thanks. Yeah, thanks, guys. But no, I mean, to that point, like you have, like if a conversation doesn't go well or a meeting doesn't go well, you have to sit and reflect and say, like, ask yourself, why did that not go well? Was that on me? Was that on them? Where was the disconnect? And sometimes it's just not a good fit, whatever it be, whether it be a collaborative thing, whether it be like, just asking for a favor, but you have to. Because that's how like you said, Rock, like that's how you're going to learn and move forward and get better at this. And so, but as you guys know, it's addictive, right? It's fun. It's addictive. This is why we stay up late when the kids are in bed to work on this stuff, because it's so much fun. And it's such a great community.
Kasie was, we were talking before here, and Kasie and I was talking about the difference between medicine and a startup, right? And in medicine, you have your lesson plan laid out, right? If you grind for 8 years, you'll get there. Or if you grind for whatever, and a startup, it's the totally opposite end of the spectrum, right? And so what I found is one thing you have to watch is you have to really know your limitations, because you could work all night. At any time, there's 1,000 things that need to be done, right? And if you don't watch yourself and know your limitations and slow down, and sort of cap yourself and realize whenever you're working, but you're not really being productive, you really can get yourself in a bind.
Yeah. And Kasie, you'll probably attest to this too. I mean, Gopi will know when I'm not there. Like I'm thinking about BackTable. Like you're there, but you're not there, right?
Yes, I
and
know
the kids
all
will
about
say
it.
something now too. My 10-year-old, he'll say something. He's like, "What's going on with BackTable, Dad?" And because he just
Yeah.
knows that I'm just thinking about something else. I'm not really there.
Yeah, for sure.
And so we in like you guys probably do. Gopi and I keep each other in check on that sort of thing. It's like,
Absolutely.
okay, if you're not here, then go take a walk, figure it out, and then come back and be present. You know what I mean?
Yeah, no, absolutely. Taking a walk's a good idea.
It's an interesting dynamic, I would say that. And it sounds like you two may be similar, but I know for us, we're very much the opposite in many things. And so that really helps balance us, like especially running the business.
Yeah. Well, speaking of that, so Kasie, I know starting a new business is expensive. How did you guys fund it at the beginning? Are you just bootstrapping? Did you go to friends and family? Where are you guys at with that?
So we bootstrapped the entire thing, actually. We did have a few people early on that wanted to invest, but Rock and I felt really strongly that if we could do it ourselves, we really wanted to do it ourselves. Part of what we do, while it's a business, this is truly personal for me and for Rock. I mean, we lived this, all these pain points, and I really want it to kind of make a difference for everyone in the healthcare field. And I want people to have accessibility to jobs. I want people to be able to just leave their job if they're not happy. And so we really wanted full control. And we've bootstrapped. We've kind of made accommodations in our lifestyle to be able to do that.
We're certainly not driving any Porsches or anything like that. We're rocking the Honda Odyssey all the way. And that's what we want to do.
It's a great car, but Rock was like, well, we'll tint the windows and it'll be really cool. And I'm like, tinting the windows. Yeah. So it's a great car.
No, we had an Odyssey until we just couldn't drive it anymore. Literally drove it into the ground, but it was perfect for two little ones. That's for sure.
Part of the bootstrapping mindset was that we want to be like the only product or platform that's created by medical professionals and backed by medical professionals. So all of the decisions that we make are driven by us and sort of the team and the decisions to make things better for either client.
Yeah. So tell us a bit about, I know there's like an algorithm and it sounds like maybe there's a AI aspect to it. Tell us a little bit about how the platform works now.
Sure.
Just to let our audience know if anybody's out there looking for a job.
Sure. So there are three aspects that we've started off and we really examined in the recruitment build. And those are quality, cost, and speed. And so our product improves on all three of those. And for speed, we do certain things such as we have integrated chat messaging alerts. We allow people to quick apply, store their documents onto our system. It's all secure. For cost, our system bucks the traditional high cost model. It's not a percent of your salary. It's not 20 or 30 grand. A hospital can recruit you for $500. For the candidate, everything's free. And so for us, there's no reason to charge us when we're really, sincere about fixing the process. And so it's all free for candidates to use. As far as quality goes, this is where we really wanted to stand out. And so really where we started crunching the numbers and looking. And so we have three items that really help us identify quality matches. And so this is helping the candidate find the job and the employer find the best candidate for that job. And so what we do is we do something called a stat score. And so the stat score looks at certain criteria, such as the location. Is we give our users 5 options to put in a location, and we're help search. And if it falls within those 5 locations, they're going to rank higher on that score. Do they want call? Do they want weekends? A lot of certain specifics that may be overlooked in other sort of means. And so our stat score really helps us identify is the fit there, is the culture there that we're looking for both sides. We also do something called a comprehensive skills analysis, which we're actually building out in our pipeline now. And so this is really cool. So the first one that I built, I'll give an example here, is for like radiology. So we look at a clinician and we break down the skills from clinical skills, and we look at procedural skills because medicine is very procedure driven, right? And so what we can do is we can have a custom template made for the employer and for the candidate. And so the employer might say, hey, I need somebody that will read a cardiac MRI, that will do a Y90, that will, also interpret this, do this procedure that's MQSA certified, And once they finalize that template, it's sent out to all the candidates they're matched to. And so as the candidate, when you see this, you're going to see a very transparent idea of what to expect when you go into the job. And so you will kind of respond with, hey, I do this. Hey, I'm open to learning how to do this, or I don't want to do this. It's just something that's I'm either not trained for or qualified or not. And so when that sends it back, that helps quantify sort of how the skill set matches. And so this is something we're doing that I think really sets us apart from any other option out there. And I've been fortunate enough to have a team of other colleagues to work with to make these in certain fields as well too. And so the stat score is the first we do. We do a comprehensive skills analysis. And then the third thing that we have been working on is a personality matching. And so the personality matching is not yet on our platform, but we do know that medicine is very much a team sport. And for example, Kasie's fellowship picked near solely on
not near solely, but personality played into it, right? Because they took 3 fellows or even for the general dermatology residency, kind of matching up. You don't want 4 alpha dogs necessarily.
Right.
Same holds true for like nurses, your medical assistants. My ancillary staff always tend to have problems with each other more than anyone else, right? And that's probably one of the reasons that we're seeing such high turnover. And we don't spend any time really matching them up personality-wise, yet it's a second family.
Yeah. And some of the other items we do to kind of stand out and to make the process better for candidates is we actually incorporate all the contract stipulations into our search results, and those can be filtered out. And so like if we know if you're productivity based, if you're going to be a private practice and just, an owner at some point on a partnership track, your buy-in from like day one. And so essentially what we can do is say you're an MSK trained radiologist and you want to, read only MSK, or you want to have a spot specifically for a musculoskeletal radiologist. You want to be in the East Coast. You want to land top 10% pay, and you want to have paternity leave in your package. You can use all the smart filters on our website to find that. And if that job exists, we'll match you to that. Or if there's something that's close, then we'll start to kind of to rank those. And so we want it to be very specific in that regards.
Yeah. I mean, isn't it amazing that something like this doesn't already exist, given that it's like Match.com, right? I mean, it's like we have this for relationships. There's a zillion relationships, platforms out there that are similar, where you have an algorithm, you can choose you can customize it. And yet we're still in the dark ages of like looking at lists of job postings, which show there's like zero, transparency, right? On those. I mean, Rock, you've probably seen like the posts. I remember there'd be posts about like doing IR, and then you call up and it's like, well, we really just need somebody to do all the fluoro and the paras and thoras. And it's like, well, that's not really IR. Like your diagnostic guys can do that, well, they don't really want to do that. Or they use they use teleradiology. So they need somebody in the hospital. That's not really an interventional radiology position, And so being able to weed that out and add that transparency, I think is going to be huge for our specialty. I know
for all, I think. Yeah. I mean, even in dermatology, when I went to look for Mohs surgery positions, many of them are, Mohs surgery 1 day a week. Once you call, right? It's a Mohs surgery position. And then you call and you find out the other 4 days a week, you're going to do general dermatology. Unless you can start to build it. But to find a full-time Mohs position, it's just very difficult. The other thing that I did want to mention is just, there was this really good study that came out in the world of academics about women and how they are way less likely to kind of move careers than men. And that a huge portion of that was due to the lack of job offers to females from like quote unquote good old boys club, right? Because today you might find a really good job offer from your mentor or from someone that you know. And I do think that there is still a mentality, unfortunately, of the good old boys club. And if you're not part of it, you might be missing out on something that's a really good job opportunity. And so I would like to level the playing field with this as well. If that does exist in medicine.
Yeah.
So go ahead, Rock.
Sorry, I was going to say some of the other options that we had built into the product is sort of like a dating app. And so we find that a huge volume of the job seekers are passive job seekers, and they may be some of the better candidates to begin with, especially with the great resignation and everything that's been kind of moving around with COVID and distribution issues. what we wanted to do is create a sort of a privacy setting that allows you to go in and you can run in private mode on the candidate side, and you can search and view jobs, and you don't have to necessarily give up all your information. So your current employer doesn't really know it's you, on the platform. So ideally, you're still be able to find the best job. And if you're at the best job, that's where you would stay. But if there is something, that you're interested in, you can look and kind of play around and not have to worry about blowback from current employers.
Right. You can remain anonymous to a certain degree.
Yeah, exactly. And so I've had 3 jobs since I finished, and 4 including my fellowship. And people always ask me about leaving and how I know to leave and when to leave. And I think leaving is really scary, right? We don't like change as physicians. Like the whole path was mapped out for us. We always knew what was next. After college, we would do med school, and after med school, we would do residency and or fellowship, and then take this job. And then suddenly you find yourself not really being where you thought you'd be at in life. And it is very hard to leave. But one of the challenges of leaving is the accessibility of where to go. And that in and of itself is, like Rock said, almost a second job sometimes. And so I wanted this to be easier for people that maybe aren't happy, that they could get on their, one day an app, hopefully on their phone, and kind of search through what's in the area and if anything pops up. Because I think like really this generation, we're treating time with more respect, and we know like we're running out of time. We should be happy. And you see this in other fields, and I want it to be present in healthcare as well.
Yeah.
Yeah. I mean, some people even say that the good jobs are all just word of mouth about who you know, right? Which is also frustrating, because what if you're out, in a rural area, or you're just not like a big networking person, and you're kind of a shy, but you're really good. I mean, there's so many things that can be limitation. And so that always frustrated me when I would hear, oh, well, the good jobs, they don't get on the job postings because they all get taken up by word of mouth. Well, that's
the good old boys club.
Yeah, exactly. That is. You're right.
If you're not right. In it, you're missing out.
It's again, exactly. Real estate, right? Real estate, the good home never comes to the market.
It doesn't even hit the market
before it's in place on the market.
Right. And to what you were saying, Kasie, a colleague of mine, actually one of our co-hosts on the VI show, she was saying that she's had people reach out to her because in interventional radiology, I think it's only 9% female. So there's very limited number of females in the specialty. And there's actually a fair number of groups out there actively trying to recruit females because they want to add that to their, to their practice. And they're having a hard time finding, good candidates. And because it's limited. So I imagine that you guys can have, and basically it's very algorithmic, and like that can help recruiters find, the type of person that they want, whether it be male, female, race, gender, whatever. Is that?
Yeah, it goes both ways, right? Like you can find who you want as the employee, but if the employer has a specific need, whether that's a skill set or whatever, then they can do that.
One item that we actually started to incorporate from feedback from our early users was that they wanted more side gigs, which goes along with the more modern type approach of the newer graduate. And so like for myself, I've done a couple side gigs along the way. I worked as a consultant for Epic, and I also did some expert witness work. And the expert witness work was a great experience, just like for my own practice, to see how some of that works and what really goes on behind the scenes. And so I think as we incorporate those, we will see a huge demand for certain things like that as well.
And
side gig. Sorry, Kasie, go ahead.
Oh yeah, no, I was just going to say, even for residents, I would love to have a place where they could locum and kind of just, or moonlight, or anybody locum, or a job share. I wish, for nannies, there's always a nanny share. I wish in our industry that we could do more physician job shares, for both genders, like
your example.
Yeah. And I just created one myself, and we used Stat Careers to do it. So I took a position that was a full-time 5-day-a-week position, and I don't want 5 days a week. And so I kind of split it with another Mohs surgeon who's going to be relocating to Ohio for this job. And I would love to see, and that's hard, right? That's really hard to find someone who's going to do that. Yeah. But what if there was a way that you could find each other and both apply to this job, and then, do something else with your life besides just medicine. Yeah. but still use your skills, right? Because I think we all love medicine and we all love practice, but then at some point it just takes over everything in your life, and you don't have time to be the parent you want to be, or to have a side job, or travel, or whatever it is that you want to do.
Yeah, it's just too much. And the whole side gig marketplace, I think, would be amazing, because I do the VA National Teleradiology program, which is great because you can make your own hours. I mean, it's a really great program. It actually pays really well considering it's the VA. Mm-hmm. And you can do it at like several, there's like numerous cities throughout the United States where you can do it. And I didn't even know about it until it was a word of mouth thing. Yeah. It's not like they publicly, but they always need people. So it's like, it's this weird thing where they don't advertise it, but they always need people. And if people could have access to stuff like that on Stat Careers, I think that would be an amazing thing.
Yeah. Yeah. That's a plan.
For both parties again, right? Solving a problem for both parties.
Yeah.
Right. Exactly.
And I think
on that same note, like, how have you guys been marketing Stat Careers? Like, what's the marketing plan? Do you have a sales and marketing team, or is it still just you guys putting all this together?
Yeah. So we've been approaching this as a combination of organic and paid. And so for paid, we have a team. And so our team has been as large as 8 people in the past and as small as 4. And so we do have someone that helps us with marketing. And so a big milestone for us is we are in the process of bringing in a true chief marketing officer. And so that was huge. But we are doing a lot of that work ourselves, but we do hire someone to help us as well. And so as far as paid, a lot of different social, we find paid social has been some good traction. The problem with that is probably some of the higher end ones are more expensive, as you may know. For organic, we have started our blog. We are planning a few giveaways for our social followers to help increase our candidates. We do have a couple conferences that we're targeting maybe for the future. And then also we have in the pipes a small YouTube streaming channel that talks about how best to position yourself as a new graduate to kind of help new graduates coming to the system. Like, what should your first so many steps be, how to negotiate a contract and things like that. So that will all be coming soon.
How are you planning on getting in front of employers?
Yeah, so we've played with multiple different options there. To be honest, cold calling works pretty well, but it's not very efficient.
Yeah, it's not scalable.
It converts, but it's not scalable and it's not efficient. And so that's where we're going to allow our CMO to kind of take the lead off that. And I assume in the future here, the plan would be that we bring someone in with a sales background. Now, ideally, would like somebody like a medical device rep that has some sales, has some crossover into medicine that could really run that with the employers. And so that would be the next position that we would expect to bring into the process.
It's all about the warm intro, right? The warm intro is the way to go. Yeah, we've been talking about that stuff internally. Because we hired our first full-time sales guy in December to sell advertising for the podcast. And it was, it's kind of like, do you find somebody from industry who is familiar with the device and these device companies, or do you find somebody who just knows how to sell really good and their skill set translates well no matter where they go? And we found a great person, and he just happened to have some background in device, and it kind of worked out. But it's hard. We used a talent agency to find that person, and they did the whole personality test and everything. But I mean, that was kind of my next question, is like, you guys just going to focus on healthcare, or if this algorithm, if the model works, are there other applications, whether it be law, accounting, sales, anything that you guys have thought out on a larger scale?
Yeah, I think the short-term goal especially is just to focus on medicine, because medicine is so complex. There's so much you can do, as you know. And I mean, we have over 500 plus careers that we're hosting on our website now. And we're working through a lot of the algorithms, starting from the top down, to kind of see how we can best improve the matching process. And so I think right now that we have a lot on our plate with just doing sort of a medical arena, but who knows, there could be applications in the future. But right now we're focused on medicine. I think the next step would be if things take off and we get more traction and we're blowing up, and what's the next step? Is we move this from the United States to nationally. Would be, and there's a lot of ifs, for that to happen. But right now we're just focusing on the U.S. market.
Yeah, and I think really healthcare, it's near and dear to us, right? And that was like the start of this. And I want to see that this kind of, revolutionizes healthcare and how you find jobs and how you match and retention and satisfaction and, your lifestyle that you can have.
Yeah, it's certainly interesting to see the responses when we talk to employers and how excited they are when they have it. So that's been very promising.
As part of your market research, and even this, I guess, could be part of your marketing to employers, have you guys looked at the cost of attrition rates? Like, for example, even just like whether it be one doctor, one nurse, one MA, what that costs when there's turnover, over a certain period of time. You guys have data like that can help with trying to, back up or try to, I guess, sell your product to these employers? Yeah,
we do. And it's variable, right? Because it's different situations, different, if certain doc leaves, you may lose certain revenue from your system. But there's a good article that was actually written by a physician, C-level. It's a few years back, and they actually penned down the exact cost of having an established physician leave your hospital. And it accounts for your opportunity costs with that physician out. It accounts for all the revenue from the referrals that they're having, referring their patients into the systems for surgeries, different imaging and things like that. And it's hundreds on hundreds of thousands that you can lose if you have someone that's very established in your community that leaves. And so for nursing, one of the kind of the cheap rules would be it costs 1.5 times the salary to replace the person that left. And so it's quite a bit, when you break it down and you look at the data.
Yeah. And interesting too, just from my own personal experience, every time someone is onboarded, your clinic slows down to accommodate that training. And so, your production drops drastically. And if it doesn't, then people walk away because it's just too hard to pick up that fast of a pace practice. So when you start talking about specialties that are seeing, 40 to 50 plus patients a day, and these girls have to come in, it's not fair to them to train them in that scenario. So you have to slow down or they're going to leave.
The cost is massive, and especially when you think about recruitment as well, right? Because they spend so much money on recruitment, advertisements, if they're using a recruiter or not. Once they bring someone in, they may pay for their hotels, like have them in person, pay for dinner and whatnot, and that person may not be a match. And so what we can do is we can help them proceed with confidence into the next step of, the interview with some of our data.
Yeah, and I imagine you guys will be collecting that data on the back end. Once you make a match, okay, how, what's the retention at 1 year, 3 or 5 years? Exactly. And then show that to your employers, and obviously put it all over your social media and stuff so that people know, hey, we've been really good at making the right match. I think that's going to be super powerful.
Yeah, that's a great idea.
That's the goal. That's when we make a match on the system, we store that data, and then we come back to that. Also, in that whole algorithm, we can actually engage the candidate down the road and say, hey, 3 months, 6 months, there's a lot of data that shows if you engage candidates, your retention rates go up. And so those are other items that are in the pipeline that we could help our employers as well too.
Yeah, Rock and I always talk about this. And, if someone's not happy, what went wrong and why did it go wrong? And, was it an issue with the contract and transparency or the job description? And if so, can we tell that to the employer? Can we help facilitate this? Because I think a lot of times, whether it's word of mouth or, a paid traditional recruiter, it's like kind of on your own once you get this job if it doesn't work out. And I think people on both ends want feedback. I mean, I genuinely believe that, people want it to work.
Yeah, I think it just a lot of times it's a very busy specialty, right? And there's a lot of items moving. We don't really take the time to analyze what may have went wrong or right. And so that's what we're trying to do with the back end data.
Yeah. Is it the culture? Is it the person? There's so many factors that are completely out of y'all's control. Even if you make a good match, it's still out of y'all's control. So you want to, but you definitely want to use that data to help improve your services. So one last question before we wrap up here on the hour. Clearly, you guys are a startup. You have probably your own employees. I don't know if you guys already told me how many employees you have, but Have you guys had any issues yourselves with recruiting and hiring and retention within stat careers?
Yeah. So I think we just went through an interview process for CMO and we interviewed 20 candidates, and it was really eye-opening, especially to see what we can do nowadays with all this work from home kind of technology. We interviewed people all over the world because this is a remote position for us. And it was so interesting to see all the different perspectives. We interviewed an individual in Argentina versus Turkey versus, a handful in the US. And it was really, really like, it helped us like in our product, like things to think about as we went through the interview process as well. And so I think that the team we have in place is whenever you work with a small team, you have to be very, very specific on who you hire. It has to be someone that really fits your culture, especially in the early stage. Because if you have like one bad egg or someone that's not really bought into the culture, it can easily bring you down when you're a 4-person operation at a certain point. And at most we're operating at an 8-person operation with some PRN work and things like that, but there's 4 full-time employees. But we've learned a lot. I can't say that we've had any real issues. The people that we have are great. And so we've had our CTO has been with us for 2 years. The individual is amazing. I've never seen anyone more talented with a computer, and the CMO I think is going to work out the same way. I think we have to be very specific when we hire. The good thing is we've been run through the ringer with interviews, with, residency, medical school, even bringing people into our own group. And so it does help. And even though it's a different industry, it allows us to kind of translate some of the stuff we've learned ourselves into that.
And there's that saying, hire slow, fire fast, right? So we're really about doing our due diligence to bring someone into the team. And if it wasn't working out, whether that be like work ethic or skill set, we would be quick to let them go.
Yeah. And I think that's the thing that we push is our product has been around transparency, and we're both very transparent people, we're very open people. And so I make sure every single task that is expected or, that they have questions about is answered. And I over communicate on that. And with something we do in medicine, right? We over communicate and close the loop. When I hire or bring someone else in, I want to intentionally do that. And I want to be very transparent. And I think doing that helps everything and is worked out very well for us.
Yeah. That hire slow part's hard, right? Because it's only so many hours in the day and you got stuff to do. You got to get shit done, and you want to get that role filled, but you're right. To find the right person, you got to take your time. When you say CMO, you're talking about chief marketing officer or chief medical officer?
Yeah, chief marketing officer.
Marketing.
Yeah. We have plenty of medical
you got your own
officers.
CMOs.
Yeah. Good question. Yeah.
Yeah. And
interviews were painful. That was a big process. It reminded me a lot of interviewing for residents or fellows. And, some people come in and they're just amazing. And then you have to decide at the end, who are you going to pick? And it's exhausting. I forgot how exhausting it was to go through that many interviews.
It is. You did mention that there was an article about, when we write the show notes, we tend to try and include articles that are mentioned during the show.
Oh, okay. I mentioned one, and we can send it to you about academic females not getting the positions because.
Yes.
So we have that. Yeah. And then I think you had mentioned an article.
Yeah. There are 2 older articles that I can send you that outlay the cost of retention in medicine.
That's what it was. The cost of attrition rate. Yeah, that'd be a good one too. So we'll include those, and then let our audience know, where they should go, how they should engage with the platform.
Sure, you can visit our site at www.statcareers, all one word.com, and sign up. You can get started right away
and get emailed when a match occurs.
Yeah, you'll be emailed when your first match is there.
Perfect. And you said you guys are working on an app in the near future as well?
Yeah, right now it's a mobile or it's a web app. That's right. And in the future, we're going to plan to build this into a mobile app to be more user-friendly for our candidates.
Well, guys, I really appreciate you coming on the show and sharing this awesome platform, which I think has huge potential. And I'm excited to, Gopi and I might even be using it ourselves here in the near future. I don't know if I told you, but Gopi's just resigned from UT Southwestern. She's taking a sabbatical, and we're going to move to France. We're actually moving to France next month.
Oh, cool.
Congrats.
For a year.
Yeah.
Yeah. And so I'm going to run BackTable from there. And I have some locums work. So I'll be flying back and forth a little bit to do the locums weeks. But yeah, the kids we enrolled them in a French school and in Paris. And so, yeah, that'll be us for a year. Yeah, it's gonna be cool. And so I think that I'll probably have Gopi just make a profile on Stat Careers so that when she's looking, I know she kind of knows where she wants to go, but she's not quite sure. But I think, we'll be some beta testers for y'all. And
that would be great.
We're happy to have you.
Yeah, absolutely. Well, Aaron, thank you for having us on. It was fun. We're a huge fan of the podcast, so it was fun to actually be on.
Well, thanks again, guys.
Thank you so much, Aaron.